Everybody able to see my screen?
I am.
Fantastic. Thank you all for being here this afternoon. My name is Rose Locklear. I'm the Field Services Manager at the Oregon Office of Rural Health, responsible for our annual Forum on Aging in Rural Oregon. And we would just like to say welcome. Thank you for being here today and joining us for one of the sessions that we had queued up for our in-person forum this year. In light of COVID-19, we're selecting a few of the sessions and offering them virtually with folks accessing technology in new ways. It seemed more relevant than ever to have our fellows from the assistive technologies join us today and talk a little bit about the resources that they have available for folks. So before we get started, I just wanted to thank the sponsors who have been dedicated to the forum: our Central Oregon Health Council, Pacific Source, St. Charles Health Systems, Samaritan Health Systems, Oregon Association of Area Agencies and Disability, Oregon PHS and People with Disabilities, Adventist Health Tillamook, Peace Health, Gobi, and Columbia Memorial Hospital. A few housekeeping items before we get started. Your audio and video are muted, so please, if you have questions, feel free to put those in the Q&A box, and I will read those to our speakers at the end of the session. Presentation slides as well as recordings are going to be posted on the Oregon Office of Rural Health's Forum on Aging webpage. And without further ado, please join me in welcoming Kevin and Brian, respectively, from Public Utility Commission of Oregon and Access Technology, Inc. I am going to stop sharing my screen and then take over. Find you, Kevin. Right, take it away. Kevin, I think you're muted.
Is that better? All right, sorry about that. Okay, as she said, my name is Kevin. I am the outreach specialist for the RSPF programs at the Oregon Public Utility Commission. And I'm going to speak briefly about both of those programs, which are the Telecommunication Devices Access Program and the Oregon Telephone Assistance Program, which is also known as Oregon Lifeline. On the slide on the right-hand side, if you have any questions, feel free to contact us. Anybody that answers will be able to assist you at that 1-800 number. And we also have a TTY and video phone number for those that need that. Or you can contact us by email. And more information about the programs are on tdap.oregon.gov. And then for the Lifeline program, it's lifeline.oregon.gov. On the left-hand side is my information. If you feel that this information is something that you would like me to come present on to you or your staff, feel free to contact me and we can set something up to do that. So the first program is the Telecommunication Devices Access Program. This is a state-funded program that provides communication equipment at no cost to Oregonians who have a disability in vision, cognition, mobility, speech, or hearing. The program began in the early 80s, and we now have approximately 6,500 recipients of equipment in Oregon. And In order to get the equipment, basically all you need to do is fill out an application and get that to us so that we can process it, and we'll ship the equipment to you, whatever equipment you choose. You can obtain the application by calling us and we can mail one, or you can get it on our webpage if you have the ability to print it out. It does need to be printed out. They cannot be submitted online. And if your organization needs a bunch of applications, feel free to contact us. We have a brochure that goes with the application, and we can mail you out a set amount of applications, however many you think you need. Just let us know, and you can email that to me or to the group email that was on the first slide, and we'll get out those brochures and applications for you. Basically, the application is pretty self-explanatory as you go through it, but you just have to make sure that all the sections are completed. I'll go over that application here shortly. Once it's completed, send that application to us, either by mail, fax, or email, and we'll get that processed usually within the first 1 or 2 business days that we receive it. Once that application goes through the process and approved, we'll order the equipment. And depending on the equipment you choose, it can take anywhere from 2 to 6 weeks to get that equipment shipped to you, either by UPS or FedEx. Real quick, I'm going to go through some of the we do offer. Captioning phones, we have 2 different types of captioning phones that we offer. There's analog and there's internet-based. This model here is the 840. It comes in the Plus or the 840i. The only difference is the Plus model only plugs into your phone jack and is analog only. Basically, what that means is somebody has to call a relay number first before they can contact you. So they call a relay number, that prompts them to put in the phone number they're calling, and that'll allow the captions to come up for the person that you're calling. The person that has the phone does not need to do that when they're making a call. They just need to pick up the phone and dial. But anybody calling into the phone has to call that relay number first. There is a little business card size cards that come with the phone that you can hand out to family, friends, doctor's offices, those types of things, so that they know that they need to call that number. The internet-based model looks the same. It's just it connects to internet either by Ethernet port or by Wi-Fi. And if you have that model, if you have access to Wi-Fi, that does away with the step of them having to call the relay service. They can just dial their number directly, and the captions will come up. We also have this model of the captioning phone. Again, this one is internet-based only, so you do have to have internet to use this one. But has some updated features from the other one, such as touch screen and speakerphone. The other one does not have speakerphone, and this one has a lot more options as far as font size, background color, font color, those types of things. There's just a lot more options to it than the other one. So if you do have internet, I would suggest getting the 2400, so you have all those options available to you. Some of the other landline phones that we offer both corded and cordless phones. All of these phones have talkback keys. If there's a caller ID screen on the phone, then they do have talking caller ID for those that are low vision or blind. And a lot of the other features are just like any other phone. They have adjustable tone settings, adjustable ring volumes, and adjustable volumes as far as the amplification. Most of these amplify up to about 55 decibels, so they do amplify quite a bit. So we would suggest trying an amplified phone before trying a captioning phone, just to see if that'll work out for you. If at some point the amplified phone no longer works for you and you decide captioning would be better, then you can go to a captioning phone from there. We do have a phone for people with mobility impairment. This is just a speaker phone. So there is no handset to this phone, but you do have the ability to get a headset with it if you choose, so that it's not blasting through the whole house. It does amplify up to, I believe it's 90 decibels, so it's very loud. And there's a couple different options for activating the phone as well. So if you look at the picture in the upper right-hand corner, there's a little pendant that comes with the phone. That is how, if you get a phone call, that's how you answer the phone, by pressing that button. Or you can also get a pillow switch or an air switch with the phone, and those will activate the phone as well. This phone has 36 programmable numbers. Once the numbers are programmed, if you activate the switch, there's a red light that will light up by each of the numbers after you activate the switch. And once the number you want to call is lit up, you hit the switch again, and it'll call that number for you. So basically, you're getting hands-free dialing option with it as well. There is a voice dialer you can get with these, but they're not extremely accurate. So I would caution you to that. You may have some frustration there, but that is an option if you choose to try that out. Cognitive impairment phone. This one's pretty self-explanatory if you can see the picture, but the top of the phone has 9 memory dial buttons where you can program a number into that button and then place a picture of that person that coincides with that number into the button. So all they have to see is the face, and they hit that button and it calls the number. Other than that, it does have a little bit of amplification, 26 decibels, and other than that, it's just a normal phone. Accessories that can be used with landline phones are shown there. The voice dialer I mentioned, the silhouette and neck loop. What those are is devices that can be paired with hearing aids that have T-coil technology, and that will broadcast the conversation into your hearing aids so that you can hear those better. The signal device plugs into the phone, and then you can plug a lamp into the outlet plug, the back of the outlet plug of the device. And what that will do is, anytime you're getting a phone call, your lamp will flash for you to indicate that a phone call is coming in. The answering machine, if you choose a device that doesn't have an answering machine, this is an amplified answering machine. So if you choose a device that doesn't have an answering machine, you can choose that option and get that with the phone. Loud ringer, pretty self-explanatory. You just connect that to your phone and you'll have a ringer of up to 100 decibels. And then the home aware kit, there's a lot to that, but we just provide the telecommunication part of it. There's that round gray disc to the right is a bed shaker. You can put that between your box spring and mattress, and anytime you're getting a phone call, that'll vibrate for you to alert you to that. There's also a strobe light on the top of the base unit that will flash anytime you're getting a phone call. This also comes with a cell phone. Connect to this with your Bluetooth cell phone, and that will alert you to any calls on your cell phone as well. We do also offer wireless equipment through the program, so we offer Apple and Android devices. The Apple devices are iPhones and iPads. We have the iPhone Plus models as well. We generally use the Plus models for those that are visually impaired or have mobility impairment where it's harder to operate the smaller phone. And then also the iPads. We have the iPad, the standard size iPad, and the iPad mini. The iPads and the iPhones come with a set amount of apps with disability that you've indicated, and those will come preloaded for you. You are able to add other apps if you choose by creating your own Apple ID and signing on to the Apple device with your own Apple ID. I will mention the iPads are Wi-Fi only devices, so you have to connect. You have to have internet connection in order to use anything that requires internet on the iPad. You cannot connect those to your cellular plan. Where the iPhones are a device that you would need a cellular plan to connect to and be able to use it through your own cellular plan. The OtterBox cases that are on these phones and iPads also need to stay on the phone and iPad at all times in order to protect the device. So If that comes off, or if that's taken off and it's broken, you could be liable for the cost of that. The Android product that we have is to the Motorola Z2 Play. You'll notice the JBL Sound Boost speaker next to that. That will actually connect to the back of the Z2 Play phone and magnetically and into a speakerphone. So anything that's coming through the phone will go through that speaker, whether it's whether you're playing music or you're on the phone with somebody. All of that will come through the speaker once it's connected to the phone. If you don't want that want to come through the speaker, you simply just take it off the back of the phone. The other two Android products, we do offer the Motorola 4X and the Samsung F3 tablet. You'll notice the Samsung tablet is also Wi-Fi only. The way our distributor is RAS Mobility for the Android products, they do it a little differently as far as apps. On these devices, there will be a application called RAS Mobility. You open that up and it lists the 5 disability groups that we serve, and you choose your disability group, and it comes up with a big long list of apps that will assist you, and you can choose which apps you put on the device from that list. So I kind of like that approach a little bit better. So that will allow you to put only the apps that you'll actually use on there. There are a few wireless accessories available. The Ditto with the watch band, that accessory is actually been discontinued, but we do have some of them in stock in our office. Basically, that's just a vibration alert system that you connect to your wireless device through Bluetooth, and it'll alert you to any messages or phone calls or anything that happens on the phone, alert you that something's going on. We do have some of these available in our office, so if you do choose to receive that, we can ship that from our office once we have somebody there to do that. Unfortunately, we're not in the office right now. The cell phone amplifier, that to your smartphone through Bluetooth as well. Basically, it allows you to take amplified phone calls on your cell phone. And then the Quattro neck loop, that will allow you to listen to your phone calls through your hearing aids, as long as your hearing aids are T-coil or Bluetooth capable. This is a quick look at the application for the program. So just on the first page, just your general information, name, address, phone number. We use the Oregon driver's license to verify Oregon residency. We do at the bottom of that page, you do have to have a alternate contact that you list there, somebody we can get a hold of if we can't get a hold of you. The second page is the equipment selection page. There's a lot going on this page, but basically if you just follow the steps, B1, B2, and B1 basically just says if you know the device you want, just write it there. That's all you would have to do if you know that. And then you can select if you want landline or wireless. So if you want landline, go under B3 and then find your disability group and choose what device you want. If you want wireless, that's in the B4 section, and choose the device you want from there. This is just the rules of the program. We just need to read through those, sign and date. And then on the last page of the application is the disability certification. We do have to have this completed by your doctor, audiologist, ophthalmologist, whoever you see for the disability. We need them to fill this out. It does have to be one of those certifying authorities listed at the top of the page. We have had people create their own box and write in their own certifying authority. Cannot do that. It has to be one of those that are listed. And then they fill out the information and sign that themselves. And then you'll send all of that information into us, or that entire application into us, and we'll process that. I won't go into questions yet. I'll take them all at the end. The next program I'm going to talk about briefly is the Oregon Telephone Assistance Program. Like I said, we refer to it as Oregon LIFELINE. This program is a federal and state program, and there's you can receive one of two different benefits through this program. You can either receive a discount on your existing home phone or broadband bill of up to $12.75 per month, or you can receive free wireless minutes, text messaging, and data through one of three companies that provide those services. In order to receive this benefit, there's an application that you would need to obtain. There's two different applications, one for the discount, one for the free service. The discount application can be found on our webpage, or you can also apply online at our webpage as long as you're receiving SNAP, Medicaid, or SSI. For the free wireless service, you can apply online at any of the providers' websites, because you do have to apply directly to the provider for these. Or you can download the application from our webpage and fill it out and send it to the company. There's two different ways you can qualify. You can either qualify through program-based or income-based qualifications. For program-based, you would need to be receiving SNAP, SSI, Medicaid, federal public housing, or veterans or survivors pension. The first three programs there, SNAP, SSI, or Medicaid, we're able to verify those through our systems, and you would not need to send any kind of documents to show that you're receiving that. The other two programs, we would need to receive something dated within the last year to show you're receiving that benefit. The other way you can qualify is income-based. So that's based on 135% of the federal poverty guideline. The slide is showing, based on household size, what your income would have to be at or below in order to qualify by income. And this is also listed on. This slide shows all of the companies that provide the discount through LIFELINE. So if you have existing service with any of these companies, you would be eligible to apply. But it has to be with one of those participating companies in order to get the discount. You'll notice that AT&T Mobility offers a LIFELINE benefit, but only in select areas. You would need to call this 1-800 number here in order to see if they provide that discount in your area. These are the three wireless providers that provide the free wireless service. You'll notice that Access and Assurance offer the same exact plan, 750 minutes unlimited text, 3 gigabytes of data. Those companies both also provide a free cell phone for you to use with the service. You can use your own device if you choose and if it's compatible. If you have your own device that you want to try to use, I would suggest contacting the company to find out if your device is compatible. InTouch Wireless is a little bit different. They offer more minutes but less data, and they do not provide a free phone. So you would have to have your own device or purchase one from them to use their service. Quick overview of the application, pretty much the same thing. Name, address, all that stuff. We do have to have the entire Social Security number listed on the application so we can verify your benefits. The home address line, we have to have a physical address. So if you have, one thing we run into a lot is the homeless population. They just write homeless in there, or they put a general delivery. We cannot use that. We have to have a physical address. So if they can use a resource center or homeless shelter or something to that effect, put that in there and we'll be able to use that. If they have a mailing address, they can put that in the mailing address line. Second page is they're just selecting how they qualify. If they select something in 2A, they do not need to do the income. If they don't have any of the programs in 2A, then they would move to 2B and qualify by income. And then they would need to provide documentation dated within the last year of any of these documents listed below that section. These are just the rules of the program. Again, each of these rules need to have your initials, first and last initial, placed in the boxes, and then sign and date at the bottom. And then the last page of the application is just where you're selecting your program or the provider that you would like to receive the service from. You'll notice Assurance Wireless has a couple extra questions to the right. Those questions are for assurance only. So if you're selecting Access or InTouch, you do not need to fill those out. The household worksheet, we use this mostly for homeless population as well. But this is basically if they're using a street address that somebody else has used to receive the Lifeline benefit, like a homeless shelter or resource center or something to that effect, they need to fill this form out to separate them as a separate household from anybody else that use that address. So they would just put in their name, use the same home address that's placed on the application, and then answer the 3 questions on the back. And then initial the boxes at the bottom and sign and date that. So that was a very quick overview of the Lifeline program and TDAP program. From there, I'll take any questions that anybody has.
Great, thanks, Kevin. I'm just going to go through a couple of them in the chat box that came in or specific to your programs before we get Brian up and going. Is there sound distortions on the phones when they amplify?
We haven't ran into sound distortion. The only thing we do run into from time to time is when you get an amplified phone, it will also amplify the on the line. So sometimes people will get a little bit of static. And the way we resolve that is we do have a line filter that we can send. Usually that will take care of that issue. But other than that, we have not had any complaints of distortion due to the volume.
And then is the program available to people living in assisted living, skilled nursing, foster homes, or, for example, someone who is quadriplegic in a nursing home?
Yes, as long as they have access to their own phone line, they are eligible. Or if they need a wireless device, they would be able to access that wireless equipment as well.
And then, has there been any disruption to the iPad supplies? We're seeing issues in our supply chains to get these to deaf individuals.
We have not run into a shortage problem as of yet.
And their cost for the iPhones and Androids?
This is a no-cost program, so it is a loaner program. So we loan the device to you at no cost for as long as you need it. Once it's no longer needed, then you would need to return the equipment to us so that we can refurbish it and issue it to another person.
And then how long to get the device once application is completed?
Okay, so like I said, depending on the equipment you choose, any of the landline equipment is generally about 2 weeks. The iPhones and iPads generally take about 4 to 6 weeks. There's a little bit more work in getting those prepared to be shipped out. The Android devices are about 2 to 3 weeks.
And is there a benefit for anyone who is profoundly deaf? Any benefits for a deaf-blind community?
Well, I don't know a lot about the apps as far as how they work with deaf-blind, those types of things. I just know that there's apps out there that will assist those groups in communicating using the iPad or using telephones. Some of the features on the phones, like the talkback keys and of course, that won't help deaf-blind too much, but for like deaf community, the application, the blind community, the talkback keys or talking caller ID will help them. The deaf-blind, you might want to get more into wireless type of equipment, but I know there's apps out there that will help them, but unfortunately, I just don't know enough technology. That's something that you could reach out to Teltex. They're the ones that issue these for us, and their technical support would have a lot more knowledge of that than I would.
Is the equipment available for everyone or only for those with financial needs?
It's actually, there is no financial restriction, so it's available to any Oregonian that qualifies based on disability.
do you engage in partnerships with CCOs or other insurers so that they can get this information and resources to their members? And are you able to help them purchase assistive technology at or below market price?
So yeah, we do partner with quite a few CCOs and those types of things where we work a lot with SLPs as well for speech generating devices. That's one thing I didn't mention. We do also offer speech generating devices, but we do get on that type of equipment. We do get the Medicare cost, but the cost that we get these phones from the distributors is actually lower than what the cost is to the public. So we do get a reduced cost on those.
Great, thank you. All right, Brian, the ball is in your court now, and you should be able to share your screen.
Hello, everyone. Well, I'm not. Oh, I believe I've done it right. If someone could nod and say they see a PowerPoint slide on the screen, that would be good. I see Kevin nodding. Okay, thank you. So yeah, I'm Brian Sacre. I'm an assistive technology specialist with Access Technologies Incorporated. We have basically 2 federal grants that I'm here to talk to you about. And there's the side hustle where we keep the lights on that might come up from time to time. But yeah, today I'm here as a representative of the Oregon State Assistive Technology Program, as well as the National Deaf-Blind Equipment Distribution Program, also known as the I Can Connect program. If we take a look at that blue streak running down the slide there, inside of it, there's a kind of a slogan that we've borrowed. It says, "For people without disabilities, technology makes things easier. And for people with disabilities, technology makes things possible." I might refer back to that in a few minutes. So I'll just kind of run you through the details first. Question 1, what is assistive technology? And it is defined, I think, by the state as any item, piece of equipment, software, program, or product system that is used to increase, maintain, or improve functional capabilities of persons with disabilities. That's a mouthful. I usually like to say to people that are asking what assistive technology is, that it builds a bridge between what you don't think you can do and the task that you want to do. But yeah, AT can be anything from mounting systems. This particular device is meant to be installed in the passenger side of a vehicle. We tried that once. It was awesome. From that point on, we have to have the dealer do it so it doesn't set off the airbag sensor. AT could also be a positioning system. So there's usually a concern when somebody is placed in a chair for pressure ulcers and things of that nature. So it's important to pick the right kind of cushioning and the right kind of supports. We actually refer to New Motion and their other organizations similar to them for this particular side of things. AT could be magnification. And in our lab, we have about 2,000 physical items, and boy, I'd say about a quarter of them are magnification. Individual magnifiers that are analog, they usually are fairly effective up to a 5 power, and then once you get to a 6 power, the size of the magnifying lens is just too small. So you'd need to step up into a digital system or a CCTV. And we have a lot of those on display for demonstration. AT can be electronic devices. This is actually something that makes me kind of happy because most people already have a phone or a tablet, and a lot of assistive technology has actually kind of been built into the mainstream, so people don't have to pay extra for the things that they need to accomplish in the digital world. And it's one of those few things that's actually getting better all the time. AT could be wheelchairs. We don't actually have one that's as snazzy as this one. Ours are somewhat boring, but we do have it at the front of our office. If you walk by, it says Access Technologies, but you look in, there's a lot of wheelchairs, transport chairs, walkers and rollators and hip kits and crutches and things of that nature. It can be durable medical equipment at times. Assistive technology could also be braces. We don't do a lot of work in braces, but every once in a while one comes through our program, and I occasionally make recommendations for them, but most of the time people come in and ask for braces, and we send them to Walmart or Walgreens, or there's a Bi-Mart next door to us. Assistive technology could be power lifts. We used to do power lifts, but we found that it's probably best if you get an actual contractor who understands the building codes involved, and that prevents our insurance from skyrocketing. Assistive technology can be educational software. One of the cooler lines on my resume is I am a dragon trainer. I just did a dragon training with someone remotely yesterday. I think I've got another one coming up tomorrow. But yeah, there is a lot of software that we have, about 500 pieces of software that goes on Windows computers, Macs, iOS devices, you know, your iPads, iPhones, iPods, and Android, not as much. But we have a ton of it for display, and actually we, at this time, at this time, a lot of companies, not Nuance, the makers of Dragon, but a lot of companies are actually making their educational software and their adaptive software free for people who are home and separated from their assistive technologies at work or at school. And if you give us a call, we can kind of refer you to what options are available there. It's also on our website. AT can also be an eye gate or adaptive writing utensils. The one on the screen there that, for those of you that can see it, is called a pen again. It's designed for individuals who have a little bit of osteoarthritis, and holding a pen causes pressure in the joints. This is meant to alleviate that pressure and still allow you to write. I'd say we have about 25 different kinds of pen for people to try and see if one of them actually helps. AT isn't necessarily for everyone. And speaking of not for everyone necessarily, AT could be eye gaze systems. These are devices that follow your eyes, and instead of using a mouse, they're great for speech communication, and they're super expensive. We don't have one, but we can refer you to TDAP if you qualify. Or there's a guy named Stuart that works for Toby who would really love to talk to you. What we're currently actually kind of digging our hands into these days actually is the telehealth devices. A few different companies have approached us, and this is actually where I think our next big investment will probably go, is a lot of devices that you wear or use and Bluetooth to your computer or your tablet or your phone. And that allows your doctor to see your measurements remotely without being too invasive, but at the same time, keeping you from having to go to the clinic or the hospital where the other sick people are. This is kind of the way of the future. It's kind of been the way of the future for about 20 years, and due to the whole COVID-19 thing, it's going to be a pretty big deal, and I expect a lot of phone calls coming in the future, the very near future, explaining to folks how to connect their devices to their other devices. so they can talk to their doctors. And finally, assistive technology could also be smart home technologies. And again, that goes back to the what may be convenience for those of us that are able-bodied. It makes things possible for people with disabilities. And just a few short years ago, if somebody needed a voice-controlled home, well, it would cost about as much as a new car. The devices themselves used to cost about $10,000, and each plug was equally expensive and made this really awesome racket. But these days, I can do the same thing with about $400 worth of parts. So that smart home technology, so long as you trust the Internet of Things, it does make life better, and it does make life possible for some folks. And some of the possibilities that are opened up by having access to assistive technology includes bathing. When we do this as a bigger group, a lot of times the topic comes up that Medicaid kind of stops at the bathroom door. And I believe that's why we have so much bathroom related stuff at the front of our store. It's somewhat necessary. I don't know a lot of people that are excited about getting a bath bench, but they do recognize that it is necessary for them. It could also be the ability to dress yourself independently, to groom yourself independently, to be able to feed yourself, to prepare your meals, to go shopping, to manage your medications, to just be able to communicate with the world. Those are all the things that assistive technology makes possible. Now, where the money comes from for these things, that's kind of where it gets a little sticky sometimes. School systems, of course, they all have departments of accessibility. Children get on an IEP, an individualized education program, and there's usually a line for technology there. And that's why I don't usually see school-age children very often, because they do okay until transition time, around 20, 22, when they're kind of shown the door of the educational system and sent out into the world. Then they meet me. There are some government programs that offer assistance with assistive technology. In my opinion, not enough, but there are some programs that help pay for these things. Private health insurance comes in from time to time. We work a lot with vocational rehabilitation to get people to keep or even get a job in spite of the things they can't control. And sometimes Voc Rehab works with employers. Microsoft, if you follow them on Twitter or whatever social media you choose, they're pretty big on how they see a huge increase in benefit from hiring people with different abilities these days. I've seen them talking about hiring people on the spectrum, and their accessibility department has some really cool people in it. That's maybe the last nice thing I'll say about Microsoft. There are private foundations and charities. There's the Blanche Fisher Foundation. That one's fairly recommended by us quite often. And other civic organizations, the Lions Club, especially weirdly in McMinnville, they're really good, but this is rural Oregon. And I don't know if McMinnville counts as that. But if you were able to go to our website and take a look, this is what the resources page looks like. It does go on for a few more pages, but it does give you some links as far as some places you can go to get some of those resources. So who is Access Technologies? We were founded in 1991. I was still in high school. And the term assistive technology was coined at about the same time. And when ATI was founded, the vision was that we would create a society where all people were valued and respected, and where all people have the knowledge, the opportunity, and the power to improve their lives and the lives of others. And with that comes the mission to ensure that all people with disabilities in Oregon are able to secure and effectively use assistive technologies. So how do we do that? Well, we have a federal program and a grant that has a certain number of checklists that we check off. The first thing that we always talk about doing is the device demonstrations. Demonstrations cost the individual nothing. They're already paid for by the grant. They take about 30 minutes of the person's time. And what we do is the person calls and says that they have difficulties doing something. And we line up some technology. We make an appointment to make sure that the technology is available. This used to be a lot more important when I was actually traveling the state, and we didn't want to have a demonstration in, say, John Day, and then later that day somebody wants a demonstration of the same technology in Brookings, Oregon. We just couldn't make that happen, so we do have to have an appointment ordinarily. These days, I don't get to travel, and let me tell you, I do miss Oregon a lot, and I hope to get back to doing in-person demonstrations. But in the meantime, we do have this pretty sweet little 4K USB camera that I can use to do remote virtual demonstrations, and that works for some of the technologies and not quite nearly enough of them. There are also device loans. So everything, give or take about a dozen items in our library, it is possible for the consumer to borrow them. For most of it, it's a $9 cleaning and maintenance fee for the first month. And that assists in decision making. So you know whether or not that piece of technology will suit your needs, or if it just becomes a $200 doorstep. That's kind of one of the cornerstones of why we exist as a program. And if you go online, our device loan library, most of it is actually listed under the device loan at the top of the web page. And with each individual item, if you click on it, you can actually see where it does say that there's a $9 maintenance fee for 30 days under most of these items. And each individual item, you can click on it and it tells you possibly one key piece of information is usually where you could go to pick this particular item up. 9 times out of 10, Amazon or eBay will be your friend in this case. But some specialized equipment, we just somehow came by it. The one on the screen, for example, it's a boomerang foot mouse. I'd have to look pretty hard to find another one, I think. And we also have state financing programs, which is to say there's an AT purchasing plan. That's a really nice way of saying that we bring things in at cost and we resell them. And because we're a nonprofit, that 5 or 10 cents more over the cost just funnels right back into the program. And it all funnels through the marketplace. So there's an assistive technology marketplace on our website, and it is a hybrid mix of new equipment that we have in our store, as well as free listings by people throughout the state. It's like a Craigslist for durable medical equipment. So if we're looking at the screen, there's an aluminum shower chair commode with casters. It's $100. That one came from us. It's brand new. And then under that, there's a GoGo LX scooter for $550. That's definitely not us. When somebody decides that they want to donate an item to us, the rehoming fee is the cleaning cost in materials and time, and I'm surprisingly cheap for my time. So that go-go scooter, if we were the ones actually rehoming it, it would probably be about $100. So it pays to pay attention to the marketplace and see when these things come in. Currently, we're not seeing very many donations come in for what I hope are obvious reasons. But when the time comes, and you see that question, what do I do with this stuff? They could always list it. And listings look like this. Each page gets its own contact phone number. If the contact name is ATI, then it's something that we're selling out of our storefront. And you'd need to either come see us or give us a call and talk about delivery. The shipping will be extra, but we do see a lot of people that go and comparative shop, and they end up coming back to us more often than not. That also falls under cooperative buying. So if somebody actually needs a piece of technology, the cooperative buying actually allows us to put the item on a layaway or a rent-to-own system. The device reutilization, that's another way of saying that we rehome the devices, even from our library if something ages out, or we just happen to have 5 of this thing that doesn't really move very much. We will put it out in the marketplace for a song and be happy to find it a home with somebody that can actually use it. And then there are the public awareness activities. I'm doing one right now. And most of the other ones that we do these days have been canceled in person. And that's something I hope we get back to in the very near future. But yeah, if you would like us to come talk to your people, whoever those people may be, we're happy to. Usually, we're happy to load up the vehicle with as much technology as we can and let people come in and get their hands dirty and actually get hands-on experience with the technologies, so they know what's working for them. And so to keep the lights on, we also do a lot of assessments that are fee for service. And that's kind of slowed down these days, but some of it we can do remotely. There are ADA/workplace assessments where we start in the parking lot and work our way through an individual's day and make sure that the building and the office and the equipment is all compliant enough that a person should be able to do the same job that anyone else could do. We do assistive technology assessments in a variety of ways. So if a person's low vision, if they can't hear, if they have cognitive difficulties, or they need computer access or mobility, we do those assessments. Again, usually through Voc Rehab, but we are kind of working more in the community over time. I already mentioned computer access. Ergonomic risk assessments, they've been kind of tricky. Most of it we can do remotely, but as maybe a few of you might know, your chair is a personal thing, and you really need to feel the back of the chair, and we're still trying to figure out how people can experience a chair without sharing the chair and all that goes with that. And if anyone has any ideas, please let me know. We do a variety of trainings. Again, I'm a Dragon trainer. I also train in other assistive technology devices and software and apps. Basically anything that we lend out to somebody, we make sure they know how to use it and how to clean it and how to take care of it. We do training on computers and input devices and software. Sometimes it's a simple phone call, and other times I spend a fair amount of time with a person who's only got one hand and has to learn how to type 35 words a minute to keep their job. And tablets and access devices and apps. And we do ergonomic and workplace accommodations in larger group settings, training the whole room instead of one-on-one with individuals. It's rare, but it happens. And also, we develop and implement accessible documents. It's kind of my other major hat that I wear is making sure that communications that go out electronically are accessible to the most number of people in the most efficient way. And that's the trainings we do. And the other federal grant that we have is the I Can Connect program, also known as the National Deaf-Blind Equipment Distribution Program. If a person has combined hearing and vision loss, the vision loss is quantified if they're in their good eye, if it's under 2200, or if their visual perception field is under, I believe it's 15%, then they qualify visually. For hearing, they need their audiologist to yell at them, really. And there is an income maximum, which is as an individual, it's under 400% of the poverty line. So if you made less than $49,900 in 2019 in income, then you made too much money for the program. But for the individuals that qualify, they're able to get telecommunications equipment to serve telecommunications purposes. So that could be an iPad, it could be a computer for email, it could be a braille display to access the internet through a computer or a smartphone. It could be the smartphone. It's a whole lot of different devices, but the main idea is it has to be telecommunications in order to borrow the equipment for the life of what amounts to the equipment. And how to receive those services. So if you wanted a demonstration, you could call or email to set up an appointment. Assessments, give us a call for a quote for one. To purchase equipment, we would say we'd say the storefront for the marketplace, or you could find it online and give us a call that way. And for special equipment borrowing and deliveries, give us a call for a quote. There was one example I had where a gentleman had contractured his hands, just part of a neurological disorder, and he wasn't able to hold a steak knife the right way, or in an effective way anyway. And so his wife had to cut his meat for him, and he said that when she cuts his meat, it doesn't taste the same. So we showed him a rocker knife, which is kind of shaped like a capital H, and one side is a handle and the other side is the blade. And it worked for him, and he wanted to keep our demo one, but the thing just been on 100 tables. So we had to get him a quote for one and bring one in. And now his meat tastes normal again. If you want to join the I Can Connect program, or someone you know wants to in on the I Can Connect program, there is an application process. The application has 6 sections. The first section's pretty boring. It's got instructions and guidelines. A lot of it can be skimmed and perused. Section 2, that's your personal information, your name, rank, serial number, phone number, all that. Section 3, this is where it gets a little sticky. We do need to verify the income, and there are a few different ways to do that. And this is usually a sticking point when an application comes through. The income verification is always missing like 1 month of a bank statement, or it's just somebody who signed a paper that says, "I promise I'm not rich." And it's a federal program, so we do have some strict guidelines as far as what qualifies as your income verification. And apologies if it does seem invasive. I don't really want to know how much you made. We have to check that box on the database in order to keep the program running. The next section is the attestation, which is to say that your doctor, your voc rehab person, your nurse, there's a list of qualified people who can speak for you that can attest to your loss of vision and your loss of hearing. Even if when I meet you, it's super obvious, we still need an attestation on record. And it, again, is a federal thing. There's some bureaucratic language that has to be very exact. And that's usually sticking point number 2 is getting the doctor to say exactly what we need them to say, and not just kind of write, yeah, person is deaf and blind. We need them to explain how that affects the person's life. Section 5 goes to the telecommunication goals. Does the person want to talk to their doctor? Do they want to just access their email? What is it that they're trying to accomplish? And it doesn't have to be just one goal. It can be a number of goals. And we do what we can to satisfy all of them. And then, then the disability verification from the doctor is actually section 6. And section 4 is actually the person describing their own personal situation. And this is the part where we have questions. And I'll just leave my contact info there for a minute.
Great. Thank you so much, Brian. So if folks have equipment to donate or questions about that, they can contact the phone number and email address that you have here. Is that correct?
Correct, yes.
And then just one quick question as we are just a couple minutes over. Does the remote patient monitoring telehealth technology allow them to share OneDrop information with their doc? Familiar with OneDrop?
That part of the technology is so new, I couldn't answer it with any degree of accuracy. But the different companies that I am talking to says that they promise that they're HIPAA compliant and they are respectful of the patient's privacy at the risk of being sued.
It is often a case-by-case situation and basis. Well, thank you so much, Kevin and Brian, for joining us today and presenting such useful information. On behalf of everybody at the Oregon Office of Rural Health, I thank you guys very much. And that's it for today. Thank you, everyone, for joining in. And if you have any questions, you can reach out to myself, Brian, or Kevin, and we'll get you answers to your questions. Thanks so much.
Thank you.